Welcome to Thursday Thought Leaders with Harbinder Narula at BW Healthcare World. I have with me today Mr. Sidharth Srinivasan, who's the CEO of Lupin Digital Health, a digital therapeutics business that uses technology to improve patient outcomes. Let us speak to Sidharth about what Lupin is doing in the business of digital therapeutics, how are they going about it, and what is the market size, and how does he hope to grow the business in India. So welcome to BW Healthcare World, Sidharth. It's a second time that we are meeting, and I'm super excited to know about what you are doing and what Lupin is up to with digital therapeutics. Sidharth, my first question to you is, let's begin with trying and understanding your journey. Tell me a little bit about yourself and how did Lupin happen? I know you were working with Tata Group before, so how did Lupin happen?
Yeah. Thanks for having me, Harbinder. Incidentally, today is the day when I complete 1 year in this journey.
With congratulations.
It's also National Technology Day. So it's nice that these two things are coming together on the day we meet. It's been an interesting journey. I think the reason why I joined Lupin Digital Health was I really resonated with the mission, right? While a lot of us say that we're trying to make the world a better place, this one genuinely felt that way. It genuinely felt that we could make healthcare more accessible, more affordable, and democratize technology in healthcare, right? So I think that was the mission that Lupin had, and they obviously had the credibility to pull this off. The challenge with technology is not that you can't build a solution. It's if you can convince both sides of the marketplace that you are here for good, that your intentions are sort of proper, and that you're here to build a sustainable business. And I think Lupin, having done this for the past 56 years, from a BITS Pilani professor, chemistry professor, starting a small unit to the conglomerate that it is today, I think I felt that it would be the right home for a service like this. So that pitch essentially did it for me. The last, I think, 1 year has sort of validated a lot of the assumptions that I had made. So one of the things, for instance, that we take very, very seriously is whatever we do, whatever we put out there, needs to be evidence-based, which means that you have to have proven results. You have to invest in real-world evidence studies. You shouldn't claim more than what you are capable of. So your claims have to be reasonable, and you shouldn't be mis-selling to patients. You shouldn't make this a ray of hope when it isn't, right? So you have to pitch this right. And I think we've stuck to those foundational principles, and that's given us some traction in this space, which I'm happy to talk about, right? So I think the journey's been interesting. I've always been in technology in some form, but I think healthcare is a particularly interesting challenge.
Right. And so that, today's conversation is about digital therapeutics. So before we deep dive into knowing about, what you are doing, for the interest of our viewers, can you explain what exactly would you mean by digital therapeutics?
Right. So the textbook definition of digital therapeutics essentially is evidence-based therapeutic interventions that are driven by high-quality software programs to prevent, manage, or treat a medical disease or disorder, right? So that's the textbook definition. I literally read it out. But what that essentially means is that evidence-based essentially means, like I said, that you have to be able to prove this. It has to be replicable. It cannot be something that works one-off. The outcomes need to be predictable, and they need to be proven by past trials, right? So that's the outcome, evidence-based part of it. Therapeutic interventions essentially means that it has a place in therapy, which means that if you are, for instance, a post-ACS patient, someone who's had a heart attack and who's had an angioplasty, and you have what's called acute coronary syndrome, then there has to be a particular role that digital therapeutics is able to play, or that software intervention is able to play. That could be a preventive role. It could be a role in monitoring. It could be a role in treating. So those use cases are quite large, but there has to be a place in therapy for DTX. And of course, then the definition goes on to talk about the fact that it is primarily driven by software. In fact, there have been tremendous advances in hardware technology in healthcare, right? So you have the kind of imaging technology today that you could only dream about 20, 30 years back. The kind of ECGs you had 20, 30 years back are now available in handheld form, which you can do at home, right? So the quality of ECG that you used to get at a hospital, you can now get at home. So I think hardware has made tremendous strides. It's in the software side of things that we really haven't felt the need to evolve, but COVID changed all of that, right? And post-COVID, there has been a sudden consumerization of healthcare. You and I expect to get our groceries at home because of the app. We expect to get our clothes at home, our shoes at home. But the thought of then having to go and sit in an OPD for 3 hours waiting on a doctor just scares you. And therefore, we now expect even therapeutic interventions as far as possible to happen at home. And I think that's the role that DTX plays. So it is an evolving space, I think. The definition will keep evolving. But primarily, I think these 2 or 3 foundational principles need to be in place. It needs to be evidence-based. It needs to be therapeutic intervention at home, and it needs to be driven by software.
So, Sidharth, how do you think digital therapeutics will transform healthcare, and specifically from the India perspective? That what are the challenges we face as a country, and how digital therapeutics could actually transform the way we access healthcare?
Yeah, no, I think the first thing to keep in mind is the fact that most disease now is chronic disease, right? And chronic disease are conditions which stay with you lifelong. In the early days, so when India was sort of growing as a country, we mostly suffered from acute conditions, right? And those tend to be because of lack of sanitation, lack of proper precautions, etc. But now, as sort of India enters the sort of middle income kind of zone, you've put those behind you. And now, unfortunately, all the rich diseases have caught up with us, right? So we have heart disease, we have diabetes, we have respiratory conditions at a rate which is, in fact, far more than what we've seen globally. And therefore, India is now being dubbed the chronic capital of the world, right? Combination of lifestyle conditions and genetics means that our predisposition to these conditions are very high. And almost 79% of deaths that happen in India now happen because of chronic disease. So I think that's the first thing to keep in mind, because you would find that DTX in India is going to target chronic as far as possible, because that's where, because it's a chronic disease, you need to live with it for a lifetime. You need to have care available at home. You can't keep rushing to the hospital whenever you need care, right? So that's the first part. I think the second thing to keep in mind is that while we are very proud of the healthcare professionals in India, they're rightfully amongst the best in the world, there simply aren't enough of them, right? So India has about 5,500 to 6,000 interventional cardiologists. So these are the kind of doctors who can place a stent in your heart, for instance. And they're only 1 in every 35,000 Indians, right? So I keep joking to my colleagues, Harbinder, that apparently the probability of being struck by lightning is 1 in 17,000 in your lifetime, right? So there's a 1 in 17,000 chance that one of us may be struck by lightning. The chance that an Indian you meet is a cardiologist is 1 in 35,000, right? So you are twice as likely to be struck by lightning than to meet a cardiologist. Maybe not in your profession, but certainly for the common man, right? And I think that imbalance is something that technology is the right candidate to try and bridge. Because what you can do with technology is you can amplify the reach of every healthcare professional and help them manage more patients simultaneously by taking the basic things off their plate, utilizing their expertise in where it really matters, and using technology or other human intervention to deal with the rest. If I have to sort of make this more concrete, cardiology, which is the area that sort of I am currently in and passionate about, is a tertiary practice, right? So people, even from the villages or from districts, would come to a large city, would get their treatment done there, and then would go back to their hometown to live their lives. What we've seen is that the quality of follow-up that they are able to get in their hometowns is obviously not at that high level that they're able to get from the best of doctors at a tertiary center. And therefore, there could be sort of some gaps in care, which can result in some form of relapse or a new event, right? Now, if the person were to go back to their hometown, if they were to continue to follow up with their GP, etc., but if they had the benefit of technology where the right questions can be put back to the specialist who treated them in the first place, then that would be sort of the right mix or the right standard of care that we can afford to a lot of people. And I think that's something that DTX, especially in a country like India, would do extremely well. And I think lastly and most importantly, the fact that we're all glued to our phones, the fact that we do all of these things, and it's not just quote unquote educated upmarket folks. Everyone in India, I think, is very excited about what technology can do for them. And therefore, the likelihood of these technologies being adopted in India is far higher, as we've seen across other spaces as well. So in that sense as well, DTX is almost something that's made for India.
Yeah. So I completely agree with you, Sidharth, because one thing that COVID did, and which I observed was being in the healthcare, that all the senior doctors, senior in age and experience, who had closed themselves to technology, and on the other side, even the users, I mean, the 50 plus bracket, who were not very comfortable using this piece of device, adapted to this device very easily during COVID. All of us who did not know Zoom, today practically Zoom is a part of our daily life. So I think it's a great time to use technology to bring efficiencies in the healthcare, because what you're doing is actually building the efficient practice for the doctor also.
That's right.
So Sidharth, how big do you think this opportunity in terms of size that India offers as an opportunity for digital therapeutics, and how do you think this segment is expected to grow?
Sure. I think the first thing that I would say is that there are 300 million Indians with the risk of cardiac disease. There are 100 million Indians who've had a cardiac event in some form, right? And so these are folks that you would now label as cardiac patients or heart patients, because they have actually demonstrated some sort of cardiac event, right? And as we know, heart disease is a progressive disease, so it doesn't completely reverse, and therefore you need to live with this condition. But what medical science now offers us a high quality of life while having this. So you may have got your first event or your first attack at the age of 40. You will live to 90, which means that the next 50 years or more than half of your life, you are likely to live with this condition. And therefore, DTX can help manage this. So if you talk about potential, I think the first way that I would put it is that it's an opportunity to serve as many as 100 million heart patients. Similarly, there are more than 80 million known diabetics in India. It's underdiagnosed, and therefore there are probably far more, but at least 80 million who actively get help. There are more than 50-60 million folks with known respiratory conditions. Again, with the nature of air pollution and the way things are evolving, this unfortunately is going to get worse, right? And so on and so forth. Across therapies, you have these large numbers. They're obviously not completely additive, which means that there will be overlaps. So for instance, in our own setup, we've seen almost 40 to 45% of the heart patients we onboard also tend to have diabetes. And that's something that therefore needs to be managed even more carefully. But I think that's the potential to serve. If I have to convert this into sort of dollar billion terms, the overall digital health market right now in 2022 is supposed to be about $4 billion in India, growing at roughly 22-24% to about $18 billion in 2030. 24% means essentially the market is doubling every 3 years. Right. So I think that's one way of putting it. The global DTX market is supposed to grow to about $100 billion in that same time period. Now, what is digital health? What's digital therapeutics? There's always a little bit of overlap, and therefore you shouldn't take these to be exact numbers. But if you look at the trend, I think almost all estimates say that it's a few $1 billion right now. It's going to double every 3 years, which means around a 24% CAGR. And therefore, it is going to reach upwards of $20 billion in the next few years, and then over $100 billion. I think the other way for me, the way that I have sort of mentally triangulated this number is if you just take cardiovascular today in India, it's a $30 billion market. The known market is about $30 billion. About 30% of this is IPD, which means the spend in the hospital. About 15% of it is pharma, right, which is essentially people buying medicines. The rest is completely addressable by DTX, right? Because all of the other spends, whether it is to try and find yourself a diet professional, or whether it is to try and get exercise rehab, all of that is addressable through DTX interventions. And therefore, I think for me, it sort of checks out that this will be a multi-tens of billion-dollar sort of industry.
Sidharth, how is Lupin addressing the digital therapeutic space? I mean, I'm sure what you've started is just the beginning, And so what is your vision? Can you share an overview of what is it that the path towards the destination looks like?
Sure. So I think starting with the destination, I think the vision is broad enough that we want to be able to serve millions of people through technology by making it sort of more accessible, more affordable. So I think that's as basic as it starts. Our medium-term goal is to be able to prevent heart attacks and also, more importantly, predict heart attacks. Right. And I think that is something that sort of motivates me every single day. It's the reason why I get out of bed and come to work. The prevent heart attacks bit comes from having what's called guideline-directed medical therapy, by having protocols that we put in place for patients, which if they follow, and these are easy enough to do, it involves having your medication on time, it involves having specific dietary interventions, specific kind of exercises, and we sort of put some goals in front of our patients, which they feel is accessible, so they can do it. But once they do it, they are able to bring down their risk. So that's the prevention part. What we also do is, because we're able to collect anonymized data and time series data, so we're able to, for instance, check your BP every week, and we're able to correlate that to outcome events that may happen in your life. All right. We could potentially establish a linkage between the way the vitals move and the event that happens, right? So God forbid, if a patient has a heart attack, right, his vitals would have trended a particular way over time, right? His BP would have moved a certain way. His heart rate may have changed in a certain way. His SpO2 would have changed in a certain way. His weight may have changed, and so on and so forth, right? Cholesterol, lipids, etc. Imagine you had not just one data point, but imagine if you had hundreds of such data points, all right? So if you had hundreds of patients who unfortunately had an event, but you were able to track their vitals over time, you and I in an Excel sheet would be able to regress this, essentially create a correlation between what thresholds when crossed triggers the attack, right? And I think that's something that we are very curious about. And if we are able to establish that, then we can actually set up a preventive or sort of an alert mechanism where we are actually able to alert a patient when they are reaching those dangerous thresholds. We are perhaps able to call an ambulance to their location on their behalf. And we can make sure that there is no loss of life associated with these events, right? So I think both of these are very, very interesting challenges and interlinked, obviously, because the more patients we're able to serve, the more access we have to anonymized data, which we can try and use to prevent or predict events.
So Sidharth, who is your ideal customer? When do you think a person should sign up for this app? When the person is diabetic, is there a family history, or anyone at a particular age do you recommend that should start accessing this app and use it as a prevention?
So that's an interesting question. The approach that most of the market is taking is to have a one-size-fits-all kind of approach. So if you have any sort of symptom or condition that you're concerned about, join us and we will offer you a standard regimen, which involves a little bit of what's called lifestyle modification. So diet and exercise, etc., which involves a little bit of doctor consultation, and you're sort of good to go. I think we've taken the contra approach, Harbinder, where we have specific protocols depending on the exact condition you have. Because we firmly believe the way to treat a heart failure patient is different from the way you treat a post-MI or a post-heart attack patient, is very different from the way you should be looking at a hypertensive patient. The extent of intervention, the nature of intervention, the kind of indications you need to check for, the kind of diagnostics you need to get them to do, is sort of fairly customized. So at the moment, patients that we are onboarding are for the specific conditions that we've built, which is broadly speaking, what's called high-risk CAD. Someone who knows that they are at the risk of an attack, where the doctor has said, ki, you better take care of yourself or you'll end up with an attack, right? So that kind of thing. Technically, we call it dyslipidemia, where there's a buildup of cholesterol in the coronary artery. And therefore, if not treated well with medication, that could lead to a blockage leading to an attack. So that's one group of patients. The second group of patients are folks who had an angioplasty and need to maintain themselves post that. And the third group of patients is heart failure patients. If I have to just make it simple, Arvind, anyone who goes to a cardiologist is our patient today. If you are going to a family physician to get yourself treated, you are not yet our patient. But we are looking in the next few months to develop simple solutions that tackle things like hypertension, that tackle things like high cholesterol, which will be more broadly applicable. And therefore, the way we've orchestrated this is that we put the cardiologist at the center of the therapy. So we acquire you through your cardiologist, right? In that sense, we are like a prescription product. We're not something that you can purchase off the shelf. And it comes back to those foundational principles of Lupin. We want to be evidence-based. We don't want to be missold. And we want to make reasonable claims that a cardiologist will understand and be able to convey to patients.
And the patient is always under the care of his cardiologist.
That's right. So the treatment protocol is given by the cardiologist, right? Legally, ethically, morally, whatever you may consider, it is the responsibility of the cardiologist to actually set up the treatment protocol. So he has examined you, he has worked with you. So he knows what kind of medication you need to be having. He knows, broadly speaking, the kind of diet that he would recommend to you, and so on. The role that I feel technology can play, or the role that other healthcare professionals can play, is to try and align you to that treatment protocol, to try and make sure that you are following it. So there's an article in the Journal of the American Medical Association, which says that just 3 months after a heart attack, 40% of patients are not following their medication anymore. And that's simply because they feel fine. And the moment you feel fine, the human condition is that we stop eating our medication, right? So to make sure that we have your medication, to make sure that you are getting the right kind of dietary, exercise, cardiac rehab kind of advice, and to make sure that all of your questions on a day-to-day basis is something that we are able to address. So I think that's the role that we are playing. And essentially, the other important aspect is that we're actively monitoring you at all times. And therefore, if, say, I'm here, my father doesn't stay with me, and I'm worried because he's a heart patient, here I know that someone is monitoring him, and whenever his vitals spike, there is a trained paramedic available 24/7 who's calling him, triaging the symptom, and if required, even arranging an ambulance for him to go to the hospital. So all of that is something that we provide. It's a 360-degree sort of safety net.
What is the cost implication for a person who starts using this technology?
So our services are available for as little as $500 a month. Sort of it starts from there. And at $500 a month, you get all of our services. There are some devices as well that we offer, and those are available at additional cost. These devices are FDA CE approved. They also automatically connect with our app. And therefore, if you're taking your BP reading, you don't have to note it down on a piece of paper and sort of put it back there. The device is sort of auto sync. But the service itself is $500 a month. Most of our patients who take an Ola or an Uber to get to the hospital end up paying more than $500 a month just to come for a consultation. And therefore, for a lot of us, $500 a month is not prohibitive. And it's a start, Harbinder. I think the nature of technology is such that sort of it starts here, and very quickly as you build scale, you are able to bring down your costs and therefore pass that benefit to more patients. So as we see more adoption, you will start seeing services get more affordable, right? A lot of our cost, in a sense, is today human intervention, because we do have coaches, right? We do have care managers, someone who's available to you at your beck and call. You could imagine that for a younger population, say if you were doing something for hypertensives, and you would have hypertensive patients as young as 25, 30, unfortunately, they may not want to have a human coach all the time. They may be okay with an AI chatbot, right? So you could imagine how those services get far cheaper because you aren't involving sort of human healthcare providers. Right. But I think it's the right kind of package for the right condition. For a heart failure patient, I will always have a human being providing that service, because there are multiple conditions to triage, but more importantly, a heart failure patient needs the empathy that only a human healthcare provider can provide, right? The heart failure patient, just think about it, right? He is unable to take a flight of stairs, something that he has been doing all his life. He's suddenly unable to do. The psychotherapeutic impact of that is tremendous, right? So when our coaches speak to patients, it's very often dealing with that sense of demotivation, that sense of neglect sometimes, that, because I'm not able to do these things, my family members all go for Shadi ka reception without me, leaving me at home. It's a very complex process where you have to reconcile mentally to how you are today versus how you need to be. And there, I think our coaches play a tremendous role. Therefore, I do believe that we will have to adapt the offering depending on what the need is. The price will always be very affordable.
I understand that there are coaches who are there, but as a patient, my interest is my consulting physician, cardiologist, cardio-physician. Now, does the doctor is he getting the real-time reports or access? How is he responding? Does he have the time to respond? So the question that I'm trying to get to is that how do we ensure that the feedback from the platform is a validated one, and it is coming after validation from the doctor?
Right. So I think we should divide this into two aspects. The first one is when do we give you advice, and when do we get you the doctor's advice, right? And I think there's a very clear Lakshman Rekha over there, which is anything that involves what's called triaging, which is trying to understand what the underlying condition is within our domain. Anything which is in the domain of titration, which means where medication needs to be shifted up or down, comes to you from the doctor. So I think that sort of remains. And both of these are directed by what's called GDMT, or guideline directed medical therapy, which means that whether it's the doctor giving you advice or whether it's us triaging and trying to understand your symptoms better, all of these go through workflows that have been designed by cardiologists and adopted as guidelines, right? And therefore, even if the doctor were to triage, he would perhaps do it exactly the way we do it, because we are both following the guideline, right? So I think that's the sort of first part. The second part is how do we get the doctor involved? Yes, I think we actually worked. So the entire solution that we have was designed by Indian cardiologists, right? So we got the top 10, 12 cardios to form an advisory board and work with us on product development. So it's been built keeping their constraints and their requirements in mind, right? So the first thing that we do is we provide an app to doctors where they are able to track all of this in real time. They get to see all of the charts, and the actual interface works like WhatsApp, because the doctors have spent 15 years studying cardiology. They don't want to do another PhD in trying to understand how to use your app, right? So your app needs to work like WhatsApp for them, but at the back end, all of it needs to get digitized, right? So I think that's the first part. The second thing is cardiologists themselves are mostly in interventions through the day, which means they're mostly in the cath lab, and they're not around to sort of answer questions, but they do maintain teams, right? So you would have maybe a junior cardiologist, you would have MD physicians, you would have a team. So the app that we provide is not only available to the doctor, but the doctor is able to nominate his team members who also have access to the app, and at varying levels can answer to the kind of queries that come to them, right? So that's, I think, the technology aspect of things, where we are able to make sure that they have access to the information they need to answer questions, and they also have a two-way with the patient, including sort of secure video chat if they want to immediately talk to the patient and so on. Lastly, I think the more practical aspect, and this is where I think having input from cardiologists helped us, is they tell us that sometimes we may not check the app, just call us, right? And they get hundreds of these calls, so they don't necessarily pick up, but our number is saved with all of our cardiologists, right? So when they get a call from us, they know that this is something which is critical. We don't call just like that, right? Some patients in their anxiety call for like very basic things, but we are able to handle those things, and we take very critical things to the doctor. So we are able to get that response, even if sometimes, say the doctor who was on duty was supposed to see the app but didn't. And that way, I think we are able to build that connect with cardiologists. But I think the more important thing is that we are able to make that distinction between the kind of issues that only a cardiologist needs to deal with, and the kind of issues where we can provide information to patients, which doesn't necessarily become time sensitive or critical. So I think that is where sort of our coaches, paramedics, etc. come in.
And Sidharth, is there any other platform like this that exists apart from yours?
I think there are a few that are coming up in some form or the other, and there will always be people attacking this problem from different lenses. So, for instance, a hospital may have its own app, but the key feature of that app will always be appointment booking, because that's the sort of key focus of the hospital, as it should be. Similarly, there could be some others who treat chronic as a sort of overriding condition and have a temperate response. I think we are in a space where the more the merrier, frankly, because we'll all grow the space together, right? The more of us, the more that we are talking about this, the more acceptance there will be in the market for digital solutions, and you will adopt something or the other, and eventually the best ones will win, right? Our focus is, if we can build the best possible protocol for a heart failure patient, if we can build the best possible protocol for an ACS patient, and if we are able to make strides in predictive technology, that we will be able to offer a service of value, and then you would probably adopt it. So I think for now, I'm very glad that a lot of people are entering this space, talking about entering this space. It just sort of creates a momentum.
And so that, do you get a pushback from the hospital? Like you just mentioned that, you're acquiring a customer through the doctor, and hospitals they've always had a very guarded approach towards protecting their customer, and, it is our customer. Do you get that pushback? And also, what is important? I mean, when you are building relationships, is it with the hospital or is it with the doctor?
Right. So again, I think it's a nuanced answer. The relationship is both with the cardiologist and with the hospital. With the cardiologist, the first relationship is always medical or evidence-based, right? a cardiologist will never recommend something to his patient if he doesn't believe in it firmly, right? And if he doesn't believe in the outcomes. And I think that's something that I have come to see and respect about cardiologists. Right? So you may disagree with them, that you may believe very strongly in your product, but the cardiologist may not. But he has that strength of conviction that he will not recommend something which he can't stand by, because for them, ultimately, their reputation in the market, it matters for them more than anything else. So I think our relationship with every cardiologist is to try and prove the science aspect beyond the convenience and all of the other aspects of DTX. The fact that this fundamentally has a place in therapy is something that we need to convince a cardiologist and then gain his adoption. Now, how we sort of deal with operationally depends on whether the cardiologist runs his independent practice or whether if he's an employee of the hospital. If he runs his own independent practice, then operationally also I deal with the cardiologist in terms of getting his team onboarded, in terms of how do we coordinate when we have to serve a patient, etc. But if he's an employee of a hospital and part of a hospital setup, then I obviously need to talk to the non-clinical staff in the hospital, the management of the hospital, to try and set up operations. So I think that's the difference. Right? Now, we do know that corporates are becoming a larger part of the healthcare ecosystem. And therefore, the way we work with them is that the patient that we acquire from a hospital is wall guarded to that hospital, right? Ultimately, all patient data belongs to the patient. So I think this is something that, thanks to ABDM, etc., all of us are very, very clear about. But I think the comfort that we give all hospital partners is that I am not here to switch your patient to another hospital. I do not care about the contactability of the patient, right? I only care about medical information. So I am not here to take your mobile number, take your email ID, take your home address, and provide it to 5 other people. That's something that I strictly don't do. And therefore, that data is encrypted and available only with the hospital. I only need use it on a sort of need-to-know basis. The medical information is something that we need to use as part of our service to patients. But again, I think we all agree that that data belongs to the patient. I think this sort of sets the tone for the way that we work with hospitals. Hospitals also understand that this is quite a niche space right now. So it's not a very large, quote unquote, revenue zone, but it requires sustained investment of not just money, which is the easy part. It is a lot of time, a lot of effort, a lot of people that you need to get to build a DTX solution. And therefore, most hospitals understand that it's perhaps better off to have a trusted third party than to try and do this all by yourself. And that's the role that we hope to play across hospital partners, is we do this one thing alone. We do it well. Why don't we work together?
And do you white label it with the hospital, or it is purely your own offering?
We co-brand it with the hospital. I think we do care that patients do know that they get the service from us, but we are happy to co-brand it. We understand that hospitals would want the front face to be theirs, and we're quite happy to work with them in that way.
And, like you just mentioned, that you access the medical information about the patient to be able to deliver the services really well. Now, how one is getting the data from the hospital or from the patient, either ways, but what is it that you do to ensure the privacy of data at your end and ensuring data security?
So I think this is a foundational principle. We've always believed in this. It's the right thing to do for a company as large as Lupin. It's also a huge reputational risk if you don't do it properly. Right? This is a very small part of a very large business, but all of that gets affected if we don't stick to these things. So apart from sort of obeying or being in tune with all of the laws of the land, what we've also done is we're working with one of the big 4 firms as a cybersecurity consultant, where they make sure that everything is kosher. When we work with a hospital or a cardiologist, they are there to sort of act as an interface, making sure that whatever requirements are sort of put to us are made available in full to our partners. So we are able to do that. We are on the journey of ISO 27001, which is the defining standard in this space for data security and privacy. So that is something that we're looking to do. And simultaneously, while it isn't an Indian standard, we are looking to be HIPAA compliant as well. And that is, again, the journey that we are on with the consulting firm. Apart from that, on the security side, we do get sort of vulnerability assessments and penetration testing done by multiple third parties. We are on the Azure stack, the Microsoft Azure stack, and there is a degree of perimeter security that they bring in full force, especially with OpenAI and ChatGPT, etc. There's a lot of interest in the Microsoft stack for healthcare players, and that's something that we adopted from day one. So there's a degree of support we get from there as well. So I think we've been very, very clear that this needs to be the foundational element, but there's always improvements as we sort of go.
Is it a very conscious step towards more of technology-related products coming out from Lupin?
So firstly, I wouldn't speak for Lupin, right? I lead Lupin Digital Health. We're an independent company. Lupin is just a parent for us. And they've made a conscious effort for us to have our own space, which means that even when we talk to cardiologists, it's our team members going and speaking to them. It's not a Lupin guy introducing us and sort of helping us. So I think that's something that we've had to do for ourselves. But yes, I think if I were to sort of answer that, Lupin does have a viewpoint that they can serve beyond the pill as well, right? So there have been, along with Digital Therapeutics, there's some fine work that's being done in the neuro rehab space. So there's a world-class center that's been set up in Mumbai. So that's obviously neuro rehab tends to be an offline physical setup. But there's a world-class center in Mumbai, and I know that they are planning to expand as well, and they've got very, very good reception. There's a diagnostics business that Lupin has set up, Lupin Diagnostics, which again, I think in a very short time has established itself in the market. So I think there are opportunities that Lupin as a parent company is pursuing outside of just pharma. But I think our focus as Lupin Digital is completely tech, and to try and see what are all the sort of the preserve of the few that we can make available to the many by using tech. And I think that's fundamentally the role the technology plays, right? So when Uber came into our lives, a private car was the preserve of a few. It's now available to many. That's exactly the role that we hope to play as well.
And at Lupin Digital Health, right now, the focus I understand is towards cardiology. Are there more such areas that you're going to be addressing soon?
So I think our focus for this year is completely cardiology. It's a very, very large space. And therefore, for me, I think getting it right in this one therapy will really help us build our confidence, build the confidence of the healthcare ecosystem, that these are serious players who want to go into depth and not folks who want to skim the top of every therapy, right? So do a little bit that sort of gets the makhan. So I always call it being a T-shaped player. So you need to be T-shaped. You need to have the depth in one area. And for us, cardiology will be that anchor therapy. As we sort of deal with cardiology, we started calling it cardio diabetes because 40-45% of our patients tended to be diabetic as well. And therefore, we had to go into the protocols of the Indian Diabetes Association. We had to start looking at how we are able to treat diabetes standalone as well, because patients did have those as well. Now, unfortunately, it's starting to become cardio diabetic renal, right? Where, especially with heart failure, you have a lot of renal issues, because when the heart stops or doesn't pump enough blood, one of the first body organs to get affected are your kidneys. And therefore, you have something called edema, which is water starts building up in the bloodstream, in the lungs, because the kidney is not able to perform its function. So I think there is a natural pull in our learning curve towards other therapies, which will allow us to perhaps set up base in that therapy going forward. There's also a pull from the from the partner side. So when we talk to a corporate hospital, they say that yes, cardiology is our anchor therapy, but we are also big into X or Y or Z. And can you build us a solution for this as well? So I think in that sense, we do sense opportunities in other therapies, both from our patients as well as from sort of corporate hospitals. But we are very cautious that we want to cover the entire cardiac continuum, which includes smaller areas like rhythm disorders, arrhythmias, tachycardia, bradycardia. We want to cover at-risk patients. So folks who haven't yet got to a cardiologist before we start entering any other thing.
As a business leader, we always face challenges. When we are creating a new product, when we are launching a new product, we're doing something that has not been done in the past. It is, disrupting to build efficiency in the system. What are some of the challenges that you are facing or you have faced in this journey to build the DTX product that you are building? And also, are there some expectations from policymakers which can help you, create more access for this product?
Right. So I think on the policy side, it obviously can be a very, very key enabler. We have seen in more developed markets that DTX treatments are mandated because they've now proven beyond all doubt that it is better to invest in the DTX therapy of 100 patients than to have to spend on the rehospitalization of 15 to 20 patients. Right? Because, and therefore, for instance, one of the large plays in cardiology in the US comes from the fact that there is a penalty to hospitals if the patient sort of gets readmitted within 3 months. Right? So because the insurance company is paying, the insurance company says that I will not pay if the guy comes back to hospital within 3 months. Right? Why should I keep paying if you're doing a bad job? And therefore, the hospital invests in DTX to make sure that the patient is sort of stable at home. There's an early warning system. They're able to treat the patient at home, but the patient doesn't have to come back. So I think there are those sort of regulatory tailwinds in those markets. You also have insurance companies buying into the concept and therefore being willing to either partly or fully subsidize DTX. I hope some of that will come to India as well. But I also take it upon ourselves that we have to build that evidence. We have to build that credibility where people are willing to invest in us. And my sense is private insurance companies may take the first step. And there could be an opportunity with governments or with other policy bodies for conditions that affect the masses. I believe that if we are able to build something very powerful on, say, hypertension or diabetes, something that affects all of us, including those in the villages, that is something that governments may have an interest in. So I think I would just take it as the ball being in our court to try and create that evidence, to try and create that pull towards this sector that becomes sort of too good to miss, right, for them. And in terms of, I think, the way I see the space evolving is that I do believe that in the next 5 years, you will start seeing this as part of insurance policies. You will start seeing this as part of employer packages where they want to make sure that their employees are safe and therefore they ask you to sort of be on this protocol, address specific aspects. You will see that change very soon.
And Sidharth, is this completely funded by Lupin or you have external investors in this project?
No, so this is completely funded by Lupin and the subscriptions that we get from our patients, right? So I think the best revenue is the revenue you're able to convince a paying patient or a paying subscriber to give us. And we're very gratified that we've started that journey. But yes, in terms of corporate funding, it's completely Lupin.
And Sidharth, let me come to you now, Sidharth, and not Lupin. What is your personal passion and how do you align it to what you do professionally?
It's an interesting question. I think for me, I firmly believe that I'll keep getting better, right? And all of us can. So our 80-year-old self can be better than our 50-year-old self can be better than our 35-year-old self, right? I know that you've become a personal branding coach, maybe not in your 20s, but a little later than that. So I take inspiration from the fact that for a topic as new as personal branding, you've discovered that midway in your career journey and built an expertise there. So I think that just goes to prove the point that you can always pick an area and get good at it enough and be enough of a master that people are able to learn something from that. So I think that's something that I firmly believe. And I firmly believe that technology will be the defining lever of growth over the next, at least in my lifetime, right? So we haven't reached that point where we are plateauing off in terms of the impact of tech. If you go and talk to the common man, if I think about our domestic help or my driver or folks who don't have the privilege that I do, technology still doesn't play as large an impact in their lives as we would imagine, right? Yes, they're able to connect. Communication is of course there, but are they able to use that in other aspects of their life? Perhaps not as much, right? I still see my driver standing in a queue in a bank, right? I still see that we've not made it easy enough for them, and therefore I'm sort of passionate about that. What am I doing about it? I think I'm sort of putting this all together. I'm doing a bachelor's in data science and programming from IIT Madras. I felt it was important to make that investment in education myself, because otherwise you end up being a dinosaur in your own field, right? And therefore that ability to be hands-on with tech was sort of important for me. And apart from that, I do sort of other aspects. I play an instrument, I quiz, and that takes most of my weekends. But yeah, I think fundamentally, I do believe that we can get better every day. And if you're really passionate about something, you need to be completely hands-on with it.
And what instrument do you play?
I play the mridangam. It's a South Indian tabla, if you know. So I used to play it as a kid. I learned for more than 10 years. I also learned Bharatanatyam for 15 years. So I used to be a dancer. I used to perform across India, performed on DD, performed in sort of, I've really been privileged that way to have had those opportunities. I used to quiz at a national level. I won one of the sort of leading competitions twice. So I've had a happy childhood, and I've had the opportunity to pick up a lot of things which help me at this age de-stress more than anything else.
Do you sing?
Not very well. My wife sings really well, and she ensures that I don't sing. But everything else, playing an instrument, playing the mridangam, listening to classical music is something that I really like.
Right. So that it has been such a pleasure speaking to you. I mean, to understand your personal side, actually, I feel that is what enhances your professional productivity as well, and brings in the kind of creativity while you do something which could be a very standardized tech product. To do things creatively is a key. And apart from, it has been very beautiful when you said the evidence that it brings in, the therapies that can be provided at home, and with software as the foundation is what defines digital therapeutics. When you say that, you are in the business of preventing and predicting heart attacks, at the end of it, what you're doing is saving lives. And that's the beautiful, outcome. And that beautifully stood out very clearly when I was speaking to you. So thank you so much for taking our time to speak with us at BW Healthcare World. We really value your time.
Thank you, Harbinder. Thank you so much.
Yeah.